Hi, I'm Warner Brock, and I'm a physical therapist with over 35 years of experience treating orthopedic, sports, and spine injuries. I'm a founder of Linear Therapy in Motion, a private practice whose goal is to help people get well, stay well, and continue to enjoy life. Over the past 4 weeks, we've been covering myofascial pain and trigger points, particularly with regard to trigger points in the neck. So today we're going to be discussing some self-treatment options that are available to you. And we've talked about how to find your trigger points in the neck, which you'll be checking for trigger points in the front of the neck, in the sternocleidomastoid, perhaps across the top of the shoulder, in the upper trapezius. You can check the neck itself for trigger points in the splenius cervicis, base of the skull, some of the suboccipital muscles. In the shoulder blade itself, you might find trigger points in the levator scapula, the serratus posterior superior, very commonly. And a little bit lower down, if you check, you might find trigger points in the rhomboid. Now, we're going to be covering the different self-treatment options available, including one of my personal favorites, which is the percussion massage gun, but we'll also be looking at some other techniques. Now, remember, this entire video series, this instructional series, is designed to be used in conjunction with your physical therapy program, okay? So I'm a physical therapist, but I'm not your physical therapist. Be sure to check with your physical therapist to make sure that these techniques are appropriate for your problem. Okay, so let's take a look at using our Theracane to treat the trapezius muscle. We can locate the trigger point in the trapezius, okay? And once we find the trigger point, we're going to apply comfortable pressure, or at the most, let's just say a good hurt, okay? We're going to apply a little bit of pressure, and we're going to count to 30, wait for a little bit of a release in the muscle, in which case we can apply a little bit more pressure. Again, try not to press too hard. You don't want to cause any painful sensations. Or at the most, like I say, just a good hurt. A good hurt is fine, all right? If you over-treat, it may leave you, sore for a day, but that's fine. You're going to live and learn and, back off a little bit the next time. Okay, and another technique we can do is we can do a little bit of a circular motion around the trigger point. So you get a little bit of a massage with the Theracane. And the Theracane is a good way to start with the trapezius. You can reach the upper trapezius trigger points. Okay, you can reach the suboccipital muscle trigger points. And you're in good control of how much pressure you apply. You can even reach the sternocleidomastoid trigger points. You want to get a little trigger point pressure release to the sternocleidomastoid muscle. And let's take a look at some other techniques that we may have to be able to treat some of the more common neck trigger points. So we can use here a lacrosse ball to get it to the trapezius trigger points. We're just going to place it on the surface, and we can get the lacrosse ball to the spot that seems a little bit tender. And then again, we're just going to apply, we can change how much pressure we put on it just by changing our position. And we can apply just that good hurt, certainly nothing painful, pressure to that trigger point. And again, we're just going to count to 30. Wait for a little bit of a release, and then we can start to apply gentler pressure, more pressure to the area. And again, we can do a 2 to 3 minute treatment to that spot before moving to another location. And you can try doing a little bit above, a little bit below, a little bit to the right, a little bit to the left. And again, just trying to get a little bit of a three-dimensional stretch or release to that trigger point in the muscle. Okay. And here's another way to use lacrosse balls or tennis balls. You can get two balls and sort of duct tape them together, but they also have devices like this that you can purchase. And these are great for the suboccipital muscles when you first start treating them. So you can just lay it on the surface. And then what you're going to do is just place them in the area of the suboccipital muscles and begin to get a little bit of trigger point pressure release right there. Again, just holding for 30 seconds, count to 30. As it releases, you can move it up, down, try different areas. And this is great for treating all of the trigger points down both sides of the neck. Another great way to treat trigger points in the neck and in the trapezius suboccipital muscles is by using one of these, either a regular foam roller or a vibrating foam roller. This is the vibrating version, which has different speeds. Okay, I'm going to just choose a nice gentle speed to treat the suboccipital muscles. You can place the neck on the vibrating foam roller. And again, you can just gently rotate side to side. And it is very relaxing. Okay, again, after a few seconds, you can try different areas. You can get into the upper trapezius, middle trapezius, applying different amounts of pressure. Okay. You can get to some of the side trigger points in the neck. I would not do the front, okay? I wouldn't do the sternocleidomastoid, but certainly some of the lateral cervical muscles that can develop trigger points, it would be fine. Okay, we're going to talk about using the percussion massage guns and some of the differences between some of the different models that you can buy. You can now get percussion massage guns for extremely affordable, from under $30 to some of the more expensive, like clinical models. This is the Hyperice Hypervolt, which I'll put the links to this company in the descriptions. But you may pay several $100s for a model like this. But let's take a look at some of the features and some of the differences and what you'll be getting for your money. Okay, so first of all, a percussion massage gun is just that. It's a massage gun that uses percussion to perform the massage. And I like them. It seems that they're very effective at treating pain and trigger points, myofascial pain in particular. So we're going to be talking about how you can use this at home to address your neck pain, your back pain. Even if it's acute, if it's chronic, you can still use one of these percussion massage guns to self-treat. So let's take a look at some of the features. First of all, this gun, this entire thing right here, is a battery. So the battery life on these is extremely good. This, for example, this battery will probably last you for up to 3 months. I have a couple of these at home. I literally sit them on my coffee table, and I may charge it once a month. I can use this at night for 10-15 minutes, set it back on the coffee table. It rarely needs to be recharged. Okay, and then so regardless of which model you get, you're going to have a power on switch, okay, off and on. You're going to have a frequency adjustment right back here of some type. Okay. And you're going to see that they have different speeds. Now, this one, this Hypervolt in particular, has 5 speeds, and it'll go from essentially 30 cycles per second at the lowest setting up to over 50 cycles per second at the highest setting. Okay, so some of the other ones, let me show you another model here. All right, so this is a model that, and there are several available on Amazon. I would say, you know, which one should you choose? Okay, well, it depends on how much money you spend, but essentially these go from less than $30 to, you know, around $100. And I think as long as you choose something that's at least 4.5 star rated, you're going to be happy with your choice. Now, again, same features. You're going to have a power on button, okay? And this one in particular, it has anywhere from, the speeds are anywhere from 1 up to 30 on this particular model. As you can see right there, okay? That says the battery life is at 100%, all right? Now, I don't think the highest level is faster than the Hypervolt, but I know that the lowest level is much less than 30 cycles per second. So these, although they're less expensive, they can have advantages. For example, you know, I have, as you notice, I've got a shock absorber ball on here. They do come with different attachments. Here's the shock absorber ball. And so let's say you have a pain that's an area that's very sensitive, it's very acute. You can't tolerate a lot of percussion on it. First of all, this doesn't have as much amplitude as the Hypervolt. You can see here, if I can get the camera to take a look at this, the excursion here is much less than on the Hypervolt. And also you can set the frequency down to less than the Hypervolt. So this might be great for when you very first start to use percussion massage to treat your myofascial and back pain. Okay, so contrast that. I'm going to contrast that. Look at the excursion on the Hypervolt. It's probably 3 times more excursion. I'm not sure exactly, but you can tell that the excursion on that, and so that's going to be more intense. Okay. Also, you don't have the low setting here is probably 10 hertz higher than the low setting on the less expensive models. Okay. So this would be something that you could use for, let's say you know your pain is not as acute, it's not as intense, or you're already used to using percussion massage to treat your symptoms. Now, what are the advantages of using, say, the percussion massage gun, okay, to just good old-fashioned trigger point pressure release by using the tennis ball or the lacrosse ball or the Theracane or the foam roller, you know, any one of those? Well, I think one of the advantages is that when you do percussion massage, okay, let's say I'm using the Theracane to treat the trigger point. What I'm going to do is I'm going to locate the trigger point. I'm going to compress it until I feel a little bit of discomfort, okay, and then I'm going to maybe release until I don't feel the discomfort. I'm going to hold that until I start to feel the tissue give, and I can slowly start to push a little bit deeper and a little bit deeper, okay? And perhaps I can move around, that type of thing, all right? But it's still, in a way, it's eliciting a little bit of a painful reaction, especially if it's a very acute trigger point, All right. So I think that's the advantage of using the percussion massage gun. First of all, the pressure, instead of it being sustained, okay, it's an on and off pressure. So it's not just a sustained pressure, it's on and off pressure, and it's so rapid that it does not elicit any kind of a pain response. In fact, it stimulates some of the sensory fibers in the skin that cause a relaxation response at the spinal cord level. And I think another advantage is that it not only provides the pressure release necessary at the location of the trigger point, but as you can see on the slow motion video that I'm going to roll in, it also has a relaxation to the musculature immediately surrounding the trigger point. Let's take a look at that. Now, what are some of the disadvantages of using the percussion massage gun? Okay, well, as stated, you may have a trigger point that's just too sensitive for trigger point massage initially, in which case you'll want to use some other trigger point pressure release method. The other thing is, like, you know, there's some muscles, like I would never want to use the percussion massage gun on the sternocleidomastoid. Okay, that's not going to work. You also probably wouldn't want to use the percussion massage gun to, you know, the temporalis muscle. You wouldn't want to use it around, you know, the bony prominences of the base of the neck, just because it will jiggle your brain. One of the other complaints I get is people say, well, I can't use the percussion massage gun on myself. I need somebody else to be able to reach some of the spots. You know, I can't get to my shoulder blade. I can't get to my lower back. Okay, well, now we have a solution for that, and let's take a look at it. Okay, so one of the devices that we recommend using is the Theracane. All right, and a lot of you are familiar with this. And now they have a device that they've just come out with. It is a coupling mechanism to attach the percussion massage gun to the Theracane so that you can use the Theracane as an extended handle for the percussion massage gun and reach those hard to reach areas. Let's take a look at it. Okay, so we have attached the coupling device to the Theracane and the curve. And then we're going to attach the percussion massage gun to the coupling device. Okay, so here we are. We have the percussion massage gun attached to the Theracane. And now we can go ahead, we'll switch the unit on. And you can see now, if I want to, I can reach all those hard to reach areas. And I've chosen one here that's low amplitude. We're going to put it on a low frequency, okay, and we can get to the suboccipital trigger points, some of the upper cervical trigger points. We can get to the upper trapezius, and again the same principles apply. We're just going to apply enough pressure to get a comfortable stretch to maybe, you know, a good hurt stretch. And again, as the trigger point begins to release, we can apply a little bit more pressure. We can do a little bit larger frequency. Okay. Or we can move to a percussion massage gun that has more amplitude. Okay, and if we have difficulty reaching a particular trigger point, for example, maybe a trigger point in the middle trapezius, we can use our percussion massage gun to a coupler on a Theracane, and we're just going to apply. And it's just a really easy way to self-treat a hard to reach trigger point. Very nice. Great for the upper trapezius and even up into the lateral neck and even suboccipital muscles, as long as they're not too tender and acute. So I hope this helps you in treating your neck trigger points. So be sure to use it in conjunction with your physical therapy program and ask your physical therapist which of these techniques may be appropriate for you. In a next series, we'll be covering low back trigger points and how to treat those. And this includes any kind of back pain you may be having, myofascial pain. Discogenic problems can cause trigger points and exacerbate disc problems. Sacroiliac joint problems, sciatica, pinched nerves, these kinds of things. So we'll be covering that in our next series. Be sure to hit the like button, hit the subscribe button, share this information with friends or family, anyone who you think it may help. It does help the channel. Thank you, and I'll see you next time.